Welcome, chiropractic family. I could not be more excited to tell you all the things that we're going to go over today because one of the marks of success is how many times you get picked up in the media. And this was an epic year. Let me tell you, the last month was epic alone. And today, as we go through this presentation, I want you to feel the pride. 126 years, we've never, and I'm going to repeat, never had this much coverage on the benefits of chiropractic care. And who do we have to thank? Well, look in the mirror. You are my chiropractic family, and you are the ones that make this happen. And I want to share with you some of the highlights on why this was such an amazing month. But we cannot stop there. See, that's the benefit of progress. At the Foundation for Chiropractic Progress, it's about what's next. And some have told me that you're only as good as the last presentation or the last award you received. So if that's true, we're doing really well. And you are with me the whole way. Let's jump in to this month's presentation. This is leading the change. This is exactly where we want to be. We want to lead the change, and we're going to do that in a very specific way. There are people that are suffering across the nation. We are on a absolute and very unfortunate summit of opioid abuse, misuse, and simple use. And that means each and every one of us can play a part in the solution to help around the country, community by community. How are we going to do that? We're going to really unite our base. We're going to progress to understanding what Drug Free Pain Management Awareness Month is and why September is one of those months where we can make a difference. First, before we talk about making a difference, we couldn't do it without these fantastic corporate sponsors, proud and really helping us build this momentum that we're having. This could not be possible without these sponsors. ChiroSecure, I call you out. You have made it possible for us to get this messaging out, and we at the foundation are extraordinarily grateful to you. 25 placements on NBC reaching millions. We couldn't have done it without you. Now, getting to September's marketing roadmap. That's why you're here today, because you want to educate. You want to motivate your community into understanding why chiropractic can help when you're about to make a choice between an opiate or a non-pharmacological option. And yes, we have done this, but now we're picking up momentum. Remember, there has been an extraordinary amount of stress that has happened within the last year and a half. Yes, we have the pandemic, and yes, we have an epidemic, but please don't forget that that other part, which is the social distancing and the stress that goes on with our daily jobs and all of the things that are happening around the world, creates that intensity. And that's why chiropractic can really help. Depression is real, and it is also what they classify as a healthcare crisis right now. And I cannot stress this enough. For you to take that moment with that patient, to touch them or put your hand on their shoulder and start talking to them about how they're feeling, how are they doing. Take those few moments to ensure that you have a network of providers that you can send them to. If it's stress or mental health, if they're a veteran, there's lots of resources out there for them. Please ensure your community networking is strong. Someone's going to need you. Someone's going to need a referral to a mental health care provider, and you can be that someone that helps them to the next level to get the help that they need. So, while they're suffering, we know they can't separate the body from the mind, and that's why depression can run high when Drug Free Pain Management Awareness Month is starting to push its message forward. Why? The past 6 years at the foundation, we have worked diligently to progress in positioning chiropractic care as a safe, effective first line approach, a solution to opioids. Whether that progress was towards the management of the guidelines, the media, or the partnerships it takes to move the needle, we want to extend our thanks to you and to those on the screen right now that have worked diligently with us. The Hope Project, Carinoids, the Institute of Medicine, the International Yoga Association, they all make a difference in helping us with understanding and getting the message out about non pharmacological care and what that means. So, what do? This is an audience that takes action. And that means that we need to have those moments of taking action. How do we do it? Well, the first and foremost is getting a template so that you can produce a opportunity in your community to showcase the awareness. That means that if you take this declaration, you download it, and you share this declaration with maybe your mayor or a councilman, someone who can make this awareness help push it with you. This is the visibility that chiropractic needs to take, but we have to do it together. This is advocacy on our own, making the steps towards Drug Free Pain Management Awareness Month so that everyone benefits. What does it look like? It's so simple. Here's the template right here. When you want to pass this resolution, all you have to do is really just fill in the lines. It's a screenshot right here. And if you put together your information, you put it down, this is an area of networking that goes so well together because listen, every single state in the United States has been impacted by the opioid epidemic. And that's where we can all make a difference. We got to put our feet on the ground and we have to put these declarations in place. Drug Free Pain Management Awareness Month is a month to start to recognize there's a better solution to manage chronic pain, and we can do it together. So as you can see here, this is the proclamation, and it just states what it is and why it needs to be in place. And I encourage you, if you're as busy as I think you are, have your front desk download it, read it with them, get them involved. Their advocacy, they're going out to their church groups, their Starbucks, all of the places that mean something, and share with them that Drug Free Pain Management Awareness Month is really about promoting a healthy lifestyle that doesn't involve them getting an addictive substance that is not part of concordant care, especially when it comes to, for example, one of the top leaders, low back pain. It impacts the activities of daily life. It's a disabling disorder, but it doesn't have to be. And as we've seen, as I talked about last month, Spine Journal came out with the non concordant care that's happening, in that if a patient that is acute with low back pain does not get the right treatment, aka following the simple guidelines, meaning seeing a chiropractor, they 30% of them will become chronic. If they're simply just given a muscle relaxer and said go on your way, they can be a statistic on chronic low back pain for the rest of their life. We cannot let that happen, because we know what we do every day in our practice. And that's what makes the difference. So, as you will see, there is a roadmap. Now, can we make this easier? Just follow the roadmap. It is so simple. It's week by week. And again, I encourage you to go over this roadmap with your staff. These are the strategic opportunities to get involved in podcasts, walking through the marketing of chiropractic effectively during drug-free pain management. And today, I'm going to walk through the key resources within this roadmap so that you can see how your community will be impacted when you instruct your staff on how, in fact, to put these pieces into play. One of them is our marketing implementation toolkit. This toolkit is available to our gold members, and as you can see right here on the screen, is we're looking at getting letters out into your community, making aware to that medical doctor who may never have had contact with you before, but is overwhelmed right now. And I am telling you, the primary care medical physicians are overwhelmed. We see it in the outpouring of burnout. We see it in the outpouring of letters to the editors. The American Medical Association also came out stating that if we lose them, they'll be difficult to pick back up. But most importantly, we're going to have a decrease. Not enough primary care medical providers to provide disease care. in the future. That means chiropractic friends, we have to step up and be there with them. So write those letters, make those lunch dates, get them for coffee, whatever it takes. You can make a difference in your community by reaching out. Some of you will say, you know what, I could care less what my medical doctor does, but respect the fact that your medical doctor has your patients and they need you to be well educated and they need to be able to refer to you. So take some time and be able to really look at what it's going to take to be with them. Now, as we go through, you're going to see that part of being engaged in this area is your social media pages. Now, I know that that's not top of mind, but it's very simple and we make it very simple. Keep those cover pages changing. You can put these on Instagram, you can put them on Twitter, whatever you want to do with your cover photo. Most Facebook pages will change their cover photo on a regular basis to show that it's a really up to date Facebook page. So patients come and they go, oh, he's engaged or she's engaged with what I am looking for in chiropractic care. Now, as we go through, there's one piece of this, and I'm going to just talk to you a little bit about the pain management. In a week on Thursday at the National at FCA, the foundation is going to host the Dose of Reality. If you can join us, I would love you to do that. You can go to our Facebook site, you can go to the FCA, the National. The Dose of Reality is a full 1.5 hours of where we are in the opioid crisis. How we all know we got here, but now what are we going to do to get ourselves out? Remember, the opioid settlements are coming. Communities need to be educated. That money needs to be spent wisely. And consumers need to know what the options are. What are the barriers to care? How are we breaking them down? And I can assure you with 100% certainty that when you see the research that's been done, and I'm going to give a big shout out to the FCA for putting this on with us. James Waden is a rock star on so many levels. And the research that he has been putting out, as you may know, he works with Duke University. It's compelling, not only for the barriers to care and how chiropractic is showcasing the importance on the return of investment, but also how consumers do. Well, you already knew, but I want to remind you that the Dose of Reality is coming. If you want to join us, you're so more than welcome to do so virtually or show up. I would love to shake your hand and welcome you into the National with me. And that's a big part of this. But let's not forget that education is key. And on this slide right here is a pain management course. This was generously sponsored by Nova Pulse. This is a pain management course available to all doctors to take for continuing education credit. And this was created by a lot of chiropractors saying, what are the new guidelines? What do the guidelines mean? How do I implement them? How do I ensure I'm treating pain care? What do I need to know about that pain care on so many academic levels? So we got you, we heard you, and we made a difference. We put this course together, and it's important for you to get your continuing education credits because a lot of you've been so busy and overwhelmed with patients, you've not been able to get to a face-to-face meeting. So virtual meetings like this, perfect. Get it on your schedule. Now, that doesn't mean you stop with learning. Remember, if you don't get that pain course, that's okay. We've got some fantastic lineups for webinars. We've got Dr. Mark Surratt. I mean, national leaders in this area in pain management. Dr. Kimberly Busson, Dr. Anthony Lisi, Rob Silverman, so many fabulous instructors, Dr. Samuel Collins and Dr. Scott Munsterman. And I'm sure many of you will recognize these names, but these are experts. For you to be the expert, you need to hear from the experts. And that's what we want for you. So don't miss these. Register today. You can go to the Facebook site and you can start registering for these particular events. Now, looking at the social media aspect of this, I just spoke about being active, being engaged, motivate your community. And how do you do that? You have to be able to get your social media posts out there. And we have fantastic social media infographics. These infographics are also found in the roadmap, so you don't have to recreate the wheel. You can go and get more infographics if you're really, really strong and you're doing a great job in your social media. Use the foundation to get more and more output into the community so that you can help them be the very best they can be. Now, as we move through, we can't forget LinkedIn. Fabulous opportunity. Look, if you're not linked in with me, please do so, because I'm going to give you articles that you can get out there that are research based, that show the quality of chiropractic care on different levels. Here's one article. The US is still feeling the effects of the crime of the century. Now, if you haven't seen it yet, there's an HBO documentary. It's called The Crime of the Century. It's really important that you watch it because it showcases how we got where we got to, but it also showcases some of the way the medical profession has had a hand in it. So I encourage you to share that with your loved ones. And this article is going to point out a lot of the research pieces that many do not know. Link in with me, Dr. Sherry McAllister. That's the step number one. I love hearing from you. I love getting the engagement because I know when we engage, you're going to send out more information, and that is the key to success. As we go through, you're going to see this particular brochure, which is called Understand Your Options to Manage Pain. Where could this trifold brochure come in handy? It's in the roadmap. We want to get this into your newsletters. If you're not doing a newsletter, feel free to email them this brochure. Get it printed at Kinko's and get into a wellness care fair where you can talk to patients that are suffering. We can't let them sit by the side of the road when they're suffering. We need to meet them where they are. If there's one thing that's so incredible and chiropractors do so effectively, is in fact that we meet them where they are and we take them where we want them to go. So get this brochure out there and make sure that you are meeting them where they are in their pain, in their suffering, and in the opportunities to really create different momentum in your communities. Now, next, coming up, we're looking at PowerPoint presentations. Oh, don't roll your eyes yet. These PowerPoint presentations are meant to be customized. So you can customize however you want, but the hard work is already done. The research is there, the information is there. You can be as simple as just hosting this particular PowerPoint, or you can make it your own with the information that is pertinent to your community. Why do we want you to do that? Because when you do get this type of information out, if you do a Zoom meeting, invite maybe 50 patients to the Zoom meeting, or you do a community service meeting in person, or you head out to a local chamber of commerce or a church group, that puts you in an opportune moment to have the discussions, to have the information present, and move the needle in the opioid addiction. I watched a TED talk last night on solutions to the opioid crisis, and it was with a chief fire parent. She was the chief for the firehouse as well as a paramedic, so she was double certified in helping patients. And one of the things that she said that made me stop and think is it was about communicating with the opioid user, and that she came in with a team. She came in with a paramedic, she came in with a spiritual advisor, she came in with community services, and she came in as a healthcare provider. That's the team we're building right now. You are the healthcare provider to really help those that need that assistance and give them opportunities in your practice to be successful. So these PowerPoint presentations, they don't have to be long. They can be pretty short and sweet, and you are the best person to showcase them on your YouTube or any presentation that you have decided to do. Your staff is monumental in getting the opportunities ready for you. So ignite them, because once they're ignited, then they can get you opportunities to speak at a variety of different places. Now, most exciting part of today, which is the F4CP updates. I want to thank you. You are the reason we're making progress. And when I show you what that progress looks like, I hope it makes you smile as much as it makes me smile. And as we go through, you'll remember you were invited and you came. You came to that virtual Olympic party that we hosted on July 22nd. It was fantastic to hear Dr. Erica Witter Davis's story. It was an 8-minute compelling story, and I got to say, it left the audience speechless. It was heartwarming. We got so many comments back to the foundation thanking us for hosting her as the keynote speaker along with Dr. Bill Moreau. Dr. Bill Moreau is in his own right. He has forged a path forward for sports, and it will never, ever be the same because of him, because he's pushed past the medical providers that said, no, chiropractic can't be in this realm. He pushed past as the Olympic medical director. He stood up with us on that virtual party and he gave an amazing and compelling speech. It moved me. It moved me because it was about pushing to your ultimate best, being the very best you can be by every day just getting a little bit better, advocating for your patients, passionately involved in the information, the continuing education, and making sure that your voice is heard. So I thank all of the participants, everyone that showed up, because we had a lot of fun and it was a great group of people showing up. Now, as we move through, let me tell you just a little bit about what happened during the Olympics. And here's one piece of it. This is my marketing director was at Boston. She was making her way up to the Acadia National Park. She stopped for lunch at Quincy Market, and this is a market outside. And this is what was playing.
Keeping you from competing. Sydney, 2000. Preparing to compete, my leg wouldn't move. My dream interrupted. The team chiropractor knew exactly what to do. I went from out of the game to in competition in 3 days. Today, I am a chiropractor. Relieving the pain, enhancing performance. Go to beyondthepain.org to find a chiropractor or learn how to become one.
That is amazing. This is in Quincy Market. What was really special about this moment, I'm getting chills as I say it, and I totally feel Alexis's passion, is she had her phone out and she recorded that for us. And she said, I'm at a network event, I'm at just having lunch, and here is this big open market with this huge screen outdoors, packed full of people having lunch. She grabbed her phone and she started recording it. Story gets even better. Her mom was totally touched because her mom knows how hard we've been working 2 years for this moment. Her mom knows how hard she worked to help us get this commercial off the ground. Her mom started recording her, Alexis, taking a recording of this video. Her mom was so proud. She's like, this is my daughter's commercial. And the whole restaurant started to clap. Can you imagine the exposure and just the fun we just got just from that one simple thing? Now, if that's not enough, as you can see on the screen right now, we secured at the very beginning, we asked the National Board of Chiropractic Examiners, will you help support us to put 5 30-second placements on NBC? And they said yes. Then we had another couple of sponsors like Chiro Secure. We had Chiro Health USA. We had Foot Levelers and Standard Process and NCMIC say, you know what? We want to support you. We want to make this moment real. Now let's get the production started. With this moment, having asked for 5 placements, I got to tell you, there has to be an angel of chiropractic in the media for us. Why? Why? Because we only asked for 5 placements. Now buckle up. Here's what really happened. We got those 5 placements on NBC, NBC Sports, and USA Network. And then they said, we will put 5 placements on each network. 5 placements meant we had 15 placements. So we're like, wow, we didn't have to pay for that. That's why I say we have chiropractic angels everywhere. One more moment of awesomeness. This is epic. During the best of Tokyo, the return to Tokyo, where you see the very best footage of the best in the Olympics, NBC gifted us 10 more 30-second spots on that Sunday. We got 25 placements. We paid for 5. And then the next part, animated billboards. I know you know what these are. They're like proudly sponsored by. So let's look at our billboard that came up, and
Brought to you
let's
by
put it
the
out.
Foundation for Chiropractic Progress.
So that animated billboard, which is quite fantastic, actually got to play 6 times during the Olympics. We were actually squished in with a number of different huge brand names. What were the brand names? Brought to you proudly by the Foundation for Chiropractic Progress was between a Modella commercial with a veteran who had lost her leg, a Microsoft commercial that was, I mean, Microsoft, how do you compete with a billboard with them? We were brought in with Marriott and Visa and Subway. Those are just 4 of the examples. Amazing, epic moments that we didn't pay for. And that, my friends, means chiropractic angels are everywhere. Now we're going to ask that you continue the energy and enthusiasm that we have started. This is Dr. Erica Witter Davis. She's fabulous on Adjusted Reality. If you haven't gone to Adjusted Reality podcast yet, please, as an advocate for the Foundation for Chiropractic Progress, I ask you to do so. Please put your positive comments into the podcast because we're growing and our listeners are growing. And you can share this happily with any patient. The more you engage your patients, the more they're going to know about chiropractic. The more they know about chiropractic, the more they're going to share, the more patients come to you. So download these podcasts. Listen first yourself so you know what's on them. Be inspired, be motivated. These are thought leaders, celebrities, all sorts of ingenious people that can talk chiropractic in a fun and relatable way. Adjusted Reality is trusted by the adjusted. So I ask that you share them, but you have to continue to listen and watch. And Dr. Erica has been a fabulous podcast as well. As you can see moving forward, why is this podcast important? Well, it was important because we are going to slide the message of chiropractic in as easy and fluidly as conversations that you have with your patients. You don't jam chiropractic down anyone's throat. That's a turnoff, and you wouldn't want it done to you either. What you do want to know is, how did chiropractic impact the fittest man in the world? How did chiropractic impact Deepak Chopra? If you don't know, you can find out. Dr. Heidi Harvick, train your brain out of pain. What about Monica Renagel, the New York chef who talks about nutrition? So many ways to educate your patients in a fun way. It has to be fun. And that fun way translated into something very, very special. A panel of 53 experts came on board. And they were from the American Medical Association, Optum, WebMD, AARP, as just a few of the judges that were there. They had 700 entries. And as you can see, those 700 entries were then chosen gold, silver, bronze. And I am so happy to report we made progress, friends. As a chiropractic family, we made a difference. How do I know? Well, we won bronze. There it is. The 23rd Annual Digital Health Awards press release out today. Even bigger news, special alert. This is a special alert happening right here today. First heard here that the award was picked up by the American Health Insurance Plans. They nominated our award to put into their smart brief. If you want to look it up, you look at American Health Insurance Plans and it's smart brief, and they showcased our award. What a proud moment for all of us. And as you look through, you're going to say to yourself, well, it was only bronze. So let's change this slide into showing you who gold and silver were. So on the gold and silver, well, Katie Couric's story by Merck. They have a revenue of $48 billion. Who is in silver? Well, MedPage Today. which is part of Everyday Health. Let me tell you what they have. They have a budget of $57 million a year, and they reach over 800,000 physicians and 60 million consumers monthly. How does it look to be in the stage with these titans? That's us, chiropractic angels everywhere. We became bronze. Yes, we can become gold. We have you, and with you, anything is possible. And speaking of anything that's possible, as we go through, we decided, since we've had some amazing success with our listeners coming to us and being in the top 10% of all healthcare podcasts across the nation, that in and of itself tells you that trusted by the adjusted is an adjusted reality. Chiropractic is number one. I just got chills saying it. So I hope you're as excited as I am. September 1st, we have an amazing speaker, Dr. Anna Lepke. She wrote the book Drug Dealer MD. Also coming out, she's got a brand new book. I don't want to miss out on reading it. It's called Dopamine Nation. She's the chief Stanford Addiction Medicine Clinic officer, and she's talking about how our society is changing and that we're being bombarded by addiction in so many ways, especially social media. So get that book, Dopamine. And I think that it's going to be a good read for all of us, because Dopamine Nation helps us all figure out how we do what we do when we do it. And our youth is suffering with depression. We have opportunities to help them physically, and physically, technically, does not get dissociated from the mental. So it's going to be a fantastic podcast. I hope you're there with me during Drug-Free Pain Management Awareness Month, because that's how we make a difference. Now, when we get to our next piece, the last part of drug-free pain management, as I thank you, is to be able to be grateful for where we are now, show up together, put our feet on the ground, and do everything that we can do to make a difference. You can't sit back and let someone else do it. This is too important. It's too much work has gone into where we are today. People have gone to jail for us. People have put their entire lives on the line to be able to offer chiropractic care. And now we're making a difference. And it's because you're active. You're an advocate to help your patients be the very best they can be, optimizing chiropractic in so many, many ways. Don't forget to join us next Tuesday for Chiro Secure. Mike Misko. You don't want to miss him. He's high energy. He's full of great information. And I cannot thank you enough for being part of our chiropractic family and making chiropractic progress. Thanks for joining me today.
Isn't it time you join the most powerful team of successful doctors in chiropractic and go for the gold? Simply go to www.f4cp.org/package and get your customized practice success solution.